Hi, my name is Dr. Greg Doerr, and I want to give you actually a simple introduction to what functional soft tissue is. Functional soft tissue featuring FAKTR is a class that I developed that associates movement assessment, functional soft tissue treatments using FAKTR, and adding rehabilitation to stabilize and develop motor pathways for imbalances and soft tissue dysfunction that's in the body. Now, the movement assessment, what we tend to do is use some of the basic movement factors that have been out there, watching people as they move, whether it's even doing a plank, watching them move their neck through different ranges of motion, watching squats, watching lunges, looking all that and picking up those dysfunctions. Then determining how much of that is going to be associated with a soft tissue intervention, whether it's a rehab intervention or whether this might be a manipulation or mobilization intervention. So through that movement assessment, we're actually going to determine which of those is the most appropriate intervention to go through. Now, once we've actually figured out it's more of a soft tissue intervention, we'll move into our FAKTR concepts and applications. FAKTR has 5 concepts. The 5 concepts are treating patients in positions of provocation, motions of provocation, adding resistance, using functional positions or activities, and lastly, adding in proprioception. The big difference with the functional soft tissue class is we actually go through the 3 applications of FAKTR, which is using the instruments for pro-inflammatory, anti-inflammatory, and just for neurologic resetting of the soft tissue. With a pro-inflammatory treatment, we're a little bit more aggressive over a very focal area for very short durations with the purpose of increasing collagen synthesis and increasing the amount of fibroblasts that are coming to the area. Our neuro applications, which are basically just the weight of the instrument with a little bit of a faster treatment stroke, we're going to be going over larger body parts or fascial chains, trying to stabilize and normalize those tissues. Basically, ones that are weak, we'll get them to wake up and start activating. Ones that are overactive, we get them to calm down. So it's more about a control-alt-delete and normalizing, rebooting the system through the central nervous system, rather than breaking down scar tissue and adhesions, which was frequently talked about with instrument-assisted work. Lastly is anti-inflammatory applications, which can be used over bruising or bursitis or acute swelling. And our techniques with this are going to be feather light. If we're going over a bursa, it's barely the weight of the instrument. In fact, it's not even the weight of the instrument, with a very, very light brushing stroke right over the area. The purpose to be improve the superficial capillary perfusion right underneath the skin to help pull the metabolites of inflammation away. The other way we can do that is by milking the swelling out. So if you have an acute ankle sprain, we can use an instrument to literally pinch down the swelling and push it all the way back into the lymphatic system. But that's one of our major ways. Our rehab aspect is training patients to learn how to create new motor pathways. One of the challenges that we see a lot when we're doing a soft tissue treatment and we're not really getting a proper response is we don't really even have the road to get that tissue correct. In other words, when you have a dirt road, you can do a soft tissue treatment and that's like paving it. It immediately wakes up the motor pathway and the person will look functionally normal. However, if you notice that after doing that soft tissue work, you haven't really created any large change in that patient functionally, that means the motor pathway isn't even there. The road isn't even there to pave. That's a rehab-oriented thing, and we go through head-to-toe rehab for all the different body parts, learning how to stabilize and improve that motor function. That is basically the summation of what we do in the functional soft tissue featuring FAKTR class, where we integrate movement assessment, soft tissue treatments, and rehab all into one class in 2 days over 14.5 hours. Hopefully I'll see you at a functional soft tissue class soon.